Hello, everybody. This is Mark Lynn. We'd like to welcome you to today's Lunch and Learn session with Elizabeth Burrows from Burrows Consulting. We're going to be talking about financial management reviews from HRSA for RHC Grant Recipients. That's been a big question here lately. A lot of people asking me a lot of questions. I am Mark Lynn. I'm a CPA from Chattanooga, Tennessee, and with Healthcare Business Specialist, and we also work with Danny Gilbert. Danny is here today, and she will be managed. If you have technical issues, you can talk to Danny about that, and she'll be taking the questions that you guys have to ask to Elizabeth at the end of the session. What we do at Healthcare Business Specialists is we prepare Medicare cost reports. This is that time when we're doing those. So if we're doing your independent RHC cost report, let us know, get us that information, because it is cost report time around here. We do RHC startups, emergency preparedness in Tennessee. If you do TennCare quarterly reports, we can help you with those as well. If you're not a member of our RHC information group, we're up to about 3,500 members now. And please join. That's where you're going to get the information much faster than anywhere else. If you do have questions, just type them in the box over here, and Danny will ask those to Elizabeth. Her presentation should last maybe 35, 40 minutes or so, and then we should have some time to answer your questions as well. Disclaimer, everything is going to be up to date as of today, and it is being recorded. We will put this on our website. We'll put it on, it's going to be on YouTube. You can watch it there. Please subscribe when you're on there. Subscribe and like, the usual YouTube sort of stuff there. So subscribe and like, and then you'll get those. Here is our website where you will find this information. So Elizabeth's slides are already on the website. As well. We're going to place a recording as well, so you can just click this link here. There's some HRSA pulse check policies and procedures, financial management policies, example from NoSOR as well as on there, and some other links of information that I thought would be valuable in regards to this financial management, because this is all new to us as rural health clinics. Typically, we have not received these types of grants from the government in the past. So what's happening with us is something unusual, and this is why we have Elizabeth here today to do this. And so there's just a series of webinars that are coming up on our Lunches and Learns. We're going to have one tomorrow. So if you're doing billing, tomorrow is going to be Billing 301 with Azalea Health. They're sponsoring it, and Douglas Swartz is one of the co-founders of Azalea Health, will be doing that session for us. So that will be great. And then on Tuesday, Charles James and I will be working on advanced subjects areas, stuff that we didn't quite cover on the first three sessions. We will cover in that. I have printed off all of your questions that we didn't answer, so we're working on getting answers for those as well. So that will be a great session for you guys. And then PRF reporting period 2. A lot of you guys have to report monies that you received in period 2. We'll be going over that as well. Many more of you didn't receive any funds. It's basically just a matter of going in to the HRSA website and indicating that you did not receive any payments, and then logging out. But again, some of you guys will have to do some more work. And of course, Danny will be doing, if you're Tennessee, this is going to interest you. We're going to have a webinar on March the 8th, and Danny will tell you how to do your quarterly TennCare report. So that's all of the advertising sort of thing from us. Elizabeth Burrows is our speaker today. She's an attorney with Burrows Consulting. She does a great job. I have been sending people to Elizabeth for many, many years, and she knows FQHC. She knows non-for-profits. She's worked with an FQHC up in Indiana. She still lives in Indiana, same town with her dad, where they have sheep. I love the sheep part. We talked about sheep just now. But Elizabeth, why don't you, and then there's her contact information. I am going to turn this over. I'm going to make you the presenter, and then before we get started, before you start telling us about this, tell us about what Burrows Consulting does and how you can help people before we get started. Sorry about that. I was asking you to do two things at once. Get your computer up and going and tell
Sorry, I
people.
was talking and I was muted, of course. So
Okay.
at Burrows Consulting, we do anything having to do with grants. So when I was at the last National Association of Rural Health Clinic conference, I said I needed a big sign that said grants are us, or if you have grants questions, come here. And I do grants at every level: local, foundation, state, and federal grants. Federal grants being my favorite and my sweet spot. I've worked since I was 19 getting grants and got my first one at 19. So really excited about anything to do with grants, especially those related to rural. And then we also do a lot with helping set up FQHCs or RHCs with applications, but specifically FQHC lookalikes has become kind of my specialty in helping people maximize federal dollars with grant money and 340B drug reimbursement. So anything having to do with that, hit me up. I've ran RHCs and FQHCs, and now I help and enjoy working with both of them. So.
Yeah. Okay, Elizabeth, if you want to push on that slideshow button there and then do present. There we go. Now it looks right. Perfect.
All right. Well, I mean, how could there be a more exciting lunch topic than financial management reviews for HRSA grantees? So first of all, I know this is a boring topic. We're going to try to make it as fun as possible, but I want you just to take a deep breath. So when you get the email from HRSA, and you're going to get that email from HRSA asking you for your financial management review, the first thing you're going to do is take a deep breath in, a deep breath out, and know that you are prepared and ready for this. Don't flip out, don't have anxiety. It just is simply a response. So we're going to kind of go through making sure you have some tools and some policies in place. So again, I'm going to elaborate a little bit. We touched on this last week, but make sure for your RHC grants that you are drawing down your funds. And I know everybody's going to say, well, of course I'm drawing down my funds. I thought they already went in my bank account. Nope, the grant funds don't. You have to have a payment management system login. You have to be drawing them down, and you have to be tracking them quarterly. Failure to do that, and you will be locked out of your grant. Also, make sure when you go into payment management system and do your drawdown that within 48 to 72 hours, that money is actually going into your account. We all know what assuming does. We don't want you to assume. Make sure that money goes into your account. I've worked with a couple of you. It's set up to the wrong account. Something in the computer system glitched. The money never came through. Someone else thought they had drawn down all their funds, and actually none of the funds had came through. So check on this. Make sure also that you are tracking how you spent your funds, which is the whole point of today. And we're going to talk a little bit more about that as we go through the financial review, but make sure you do know how you spent your funds. And when I say track how you spent it, this is really a reimbursement grant. So you either have to have already spent the money, or you will spend it within 24 hours of receiving that grant funding. Also, are you submitting your FFR reports? These are your quarterly reports. They really are pretty much pre-populated. You really just have to log in and confirm, and it will tell you how much you've drawn down of your grant and how much is left. Make sure you are drawing that down before June. Do not wait and try to do a big lump sum. I've already talked to some of you that when you've called HRSA, they say, please don't do that. I agree. Start drawing down if you have not today. And make sure you are reviewing your notice of award. So the NOA or the PDF that came saying that you received funding, make sure you go back and look at that. So that is your grants Bible. That has every rule, every requirement you have. That is your, for lack of a better word, contract with the government. So make sure that you know that you are submitting by the proper dates. Please know you may call your friend. So I could call Mark and say, what's your NOA say? His may be slightly different than mine. So don't rely on, oh, well, I have that friend and she tells me when those are due. Make sure you read your notice of award. If you have separate EIN numbers, so you receive separate actual grants for your separate clinics, that you read every NOA. Do not pull one and say, oh, I know every due date, I know every report that's due. Some of them required revised budgets, some of them require extra reporting. I have not been able to make sense of how or why those things happen. It might have just been random, but make sure if you have separate notice of awards, you have read them all and you're checking things off as you meet those deadlines and get those things done. Now, I think it does say in little print, you may be subject to a financial management review. What is a financial management review? It is a virtual review right now. Nothing is happening in person. It's a review of your policies and procedures. And right now they have just named 5. We're going to talk about each of those 5 in depth today. Also, make sure you respond to emails and all HRSA correspondence. Most of these people are not government workers, they are contractors, but they will have an email address that says elizabethburrows@hrsa.gov, marklyn@hrsa.gov. So that does tell you that it is legit. I know many of you, once you got your grant, have been subject to various scam emails saying, pay this for signing up for SAM or pay this for that registration. If it is from a hrsa.gov email, it is legit and you need to respond. This is an active process. Don't get the email, file it, and think I'll get to it later. Usually there is a deadline, and usually the deadlines are tight. I mean less than a week tight, sometimes 72 hours tight. So make sure when you see that, I don't want you to think, oh, I'm busy in clinic, I'll look at that this weekend, and it's Monday, and you're saying I'll get to it on Saturday. That may not be enough time. Friday may very well be the deadline. So please make sure to respond. That being said, HRSA does have grace with this. And I mean, you don't see in the news people ripping that have been awarded grants, getting grants taken and all this drama. So you know HRSA is going to work with you, but you still need to be responsive. Also, they don't pick when you're on vacation. They don't pick when a family member's sick. They don't know that. So make sure that you are responsible. And if it is your name and your email on that grant, and you are going out of the country, or you are going on a 2-week European cruise, this happened to one of my clients, that's why I'm telling you this story. And he thought, oh, I'll check my email a couple times while I'm on the cruise, and he missed it because it went to a spam folder, and then he had to do extra paperwork afterwards to make it up to HRSA. Did they lose the grant? No. Did he have a very time-intensive review and had additional headaches that could have been taken care of very quickly? Had someone back in America been checking that regularly? Yes. So please, if you are on it and you're taking vacation, which I know everyone right now needs, and especially all of you that work all the time in healthcare, I know you need that vacation, but please, please make sure you are checking your email and someone is responding. Okay. Now we are going to go through the 5 elements that you are expected to be ready for. So there is a thick manual, and in the email that you received from HRSA, it did tell you what you have to be ready for, and there are links for that. Additionally, no SOAR has resources, as Mark referenced. Also, there is an attachment and a link in your email that links you to the actual laws and sample policies. I have tried to take it from that, simplify it down as much as possible, but to make sure that you are capturing the necessary information. So for cash management, you may already have cash management policies. What you probably don't have are policies on federal drawdowns. So please know, if you already have this and you say, okay, I can tune out, I'm going to check my email because I already know cash management, Elizabeth, I've already been through an audit, I have a big RHC, so check mark, I'm done. No, you have to make sure you have policies on your federal drawdown and payment management system. They might be called the same thing, they might not. So again, this is a sample policy to show, and the feds love it when you can reference their Code of Federal Regulations, which they reference in their email. So again, it has the regulations and that you are going to draw down federal funds based on actual expenses. So this is what I spoke about earlier. You cannot just say, well, I know I've spent more than $50,000 on my RHC. Click, click. I want my $49,000 in my bank account and I'm done. No, you actually must track and see, okay, salaries. Was this time tracked appropriately? If you have to, create an Excel sheet and say, 20% of Elizabeth's time was paid through the grant, have me sign off on that, show that funding. Was actual salary expense pulled from the payroll system? Show it. I know many of the payroll systems that I've talked to, ADP and others, checks, the paychecks, I think they have this already set up where you can put a grant in or show how the funds are coming out, or that you have invoices to show the direct costs. So, I've put in some samples, but again, I hesitate to even give everybody sample policies because I don't want you to cut and paste in Word and say, I'm done. Make sure you're doing that. Do you even have an RHC manager? Maybe it's your hospital CFO that's going to review it. Maybe it's the hospital controller. Make sure you adapt this where it's appropriate. Maybe it's the owner. Maybe it's the clinical director. Maybe it's the executive director that's going to draw down from payment management system. Any of that is okay, but make sure that these things are updated based on what you are doing for your clinic. Okay, and looking at the accounting system, you have to have a policy on your accounting system. You are supposed to use generally accepted accounting principles, which Mark could teach you way more about than I can, so I'm not even going to try to go into that. But make sure you are showing what accounting software you use, whether that's QuickBooks. I'm trying to think. I know there's a ton of different accounting softwares out there. That's what comes to my head first. But whatever accounting software you're using, that you have it in here. And make sure that you are tracking. And again, at a minimum, if you don't have fancy software, at a minimum, you have your Excel spreadsheet that shows how you've spent all your money and you've scanned in your receipts or those timesheets. For many of you that I worked with on the grant, this is why salaries are the easiest, because your salaries are already shown. You're already tracking time in some form or fashion through payroll. So that makes it easy to show that. But make sure that your accounting system can differentiate the grants and can show how you've spent those grants. And the grant activities are being reviewed. I understand for some of you it's a 3 or 4 person shop, but divide those duties by 3 or 4 people. If you have and you pay an outside firm to do your accounting, make sure your policy reflects that. I don't want you to cut and paste this saying we use this software when actually you contract with ABC accounting firm in your town to actually keep your books. But make sure if you are contracting with someone to keep your books that they are keeping the grant funds separate. So you do need a proper accounting system and you need some sort of authorization system. Don't complicate this. I almost feel this policy is probably on the edge of being too complicated for some of our RHCs. Do the checks and balances as you can and simplify as much as possible. Okay, and we're going to have 2 slides discussing this today. So disbursements and procurement, and then we're going to talk a little bit more about this. So this is kind of a 2-parter. So if you see the slide and you're like, Elizabeth left things out, I already read the email, we're getting there. This is the most intense policy you have to have. This is probably the most complicated and the one that most people sometimes have issues with. And when I say sometimes, I mean all the FQHCs have to go through this. All the FQHC lookalikes that just got grants all went through this. And now the RHCs are going through this. So this is the one that my clients have had probably the most challenges with. So in looking at your disbursements and procurement policy, and disbursements is just how am I spending the grant? Procurement, how do I decide where to purchase things? And the point is that, I can't just purchase products from my husband's company with all the grant funds. I can't show favoritism. I have to have a plan for conflict of interest. This is especially true for the nonprofit RHCs and provider-based, that, the hospital follows their proper procurement policies or your nonprofit follows their nonprofit conflict of interest policies so that grant funds aren't being done or spent in the wrong manner, quid pro quo, or anything like that. So in looking at your disbursements and procurement, you must address the conflict of interest. So you have to have a conflict of interest policy. If you already have that, incorporate that into your procurement policy. There must be some sort of oversight and monitoring. And again, maybe if you're a 3-person shop, that is your external accounting firm. Maybe if you're a 3-person shop, you guys check on each other. You have a checks and balances. Maybe somebody else who works part-time comes in and helps do a check and balances. But make sure there is oversight and monitoring of any of the cash and the way the grant funds are being spent. That you do have a segregation of duties in place, and again, that there are checks and balances. You also need to have how you hire consultants and contractors, and making sure that you do follow the proper code for that. And the things that can dictate the procurement process are, the amount, how much is it going to cost me, the number of bids, how many bids do I have to get, and record retention. So when you are writing your policy up for procurement process, these are things you need to address, that we require so many bids, that we consider the price, and making sure you keep record of that. Additional things in looking specifically at procurement. And as long as you're using it for salaries or you're buying supplies, that's fine. This is where I'm deciding I'm going to contract with a group to do about a huge social media marketing campaign about vaccinations or something like that, where you're using a company. But factors to consider are your price, is it reasonable, is it allocable, and is it allowable? So are you able to spend the money? Can you allocate it for that? What quality the person has, are they available, qualifications. And again, always you can Google these 45 CFR 75.327 and 0.335, and they will come up and give you the full law. Now, you're going to say, well, I just used it on salary, so I don't need the procurement policy. I'll check that off my list. No, according to what HRSA has said, yes, they will be still going through the procurement process. So you have to have a procurement policy. These 5 policies, the cash management, the duties, the accounting system, that's what they're looking for. They're also looking for a timekeeping policy. And if many of you may already have this, that's fine. To me, this gets a little complicated with exempt and non-exempt employees, and I start getting a little confused, and are these accurate, and so on and so forth. So as long as you're keeping proper time and you have a timekeeping policy, it's probably okay. Just make sure that if an employee is being paid by a grant, that is being properly allocated, shown, and that it's signed off on. Also know if you put a certain employee or position in the grant and that person switches, that you make sure that the new employee is fulfilling the terms of the grant. So let's say that you had a marketing and outreach person, so it made sense that they were doing it, but then when you rehire, you decide to hire a billing manager. Well, it may not make sense with this grant to pay for your billing manager. It probably doesn't. That doesn't meet the terms of the grant. Your marketing and outreach person did. So you want to make sure to watch that and make sure that you're not just saying, well, that person filled this person's role. Or sometimes it even gets more complicated. Let's say that Mark works for you and Mark now moves into a different role. So he was doing marketing and outreach, but now he's going to be in charge of maintenance and facilities. Well, that doesn't really jive with the grant. But again, you're saying, well, I was paying Mark. But again, it was Mark's role and what he was doing for the grant. So make sure to watch that as well. Okay, this is a newer regulation. So if you have ever done these policies in the past or been through an audit in the past, you may say, Elizabeth, I already have a lot of this stuff done. This is probably one that you do not have. This is something that has been new. I think it came during the Trump administration where this was something that was addressed fully. For some of you who know the laws better, this may have been from before that, but I know that it was updated then. The allowability of costs. So if you are using federal dollars, you must comply with all legislative mandates. Now, I was hoping Mark was going to show his crystal ball guy that says this presentation is only as good as today. So I have included examples that are what is happening right now. there may be a new law that comes and changes one of these, adds something or whatever. So these have been things that change regularly. So make sure that you watch that and keep your policies updated. And I will tell you, it is a little hard to keep track of. So make sure you're on those HRSA listservs and you do read your email from HRSA to make sure that you do that. So this is not, I'm not going to get into a political debate, or we don't have to go into any of these things, but these are federal mandates that you cannot do. You can't pay a salary in excess of executive level 2. I guarantee if you have a doctor, they are in excess of that. So the salary limits are set at a certain amount, and that's all that can be paid through a federal grant. I think it's $190,000-ish. And so you have to reallocate that lower. So if you are paying someone that makes more than $190,000, you better make sure to check the regulation and know how to only use less of their grant amount. Gun control, you can't lobby with these funds. That you will acknowledge the federal government if things are out there. And I know I've seen some of you do that in your press releases, in your billboards. Not used for abortions or human embryo research, and not to promote the legalization of Schedule I controlled substances. This should not be a problem based on the terms of the grant at all. Additional things, again, you have to comply with your legislative mandates, but these are the things you have to say. And so, you know, you can't restrict employees from being a whistleblower, that you have to annually review HRSA legislative mandates and update your policies, that you have a secure computer network, so to not allow inappropriate access. So, you know, just making sure that you are following the legislative mandates that do change. Okay, just a reminder, if you adopt the policies, you have to follow them. So at this point, the review is going to predominantly be looking at your policies, but as things get deeper, as more grant funds come out and things like that, you may decide to go after more grant funding. There's a lot of funding out there. If you go on HRSA.gov, SAMHSA.gov, all kinds of grant funds are out there right now. So go look, because you know you want to have these policies in place, but make sure that you're following them. It makes no sense if you say a CEO or RHC manager and you don't even have that position. So actually read them, don't just adopt them. Make sure other people know about these policies. So if you are working with an outside firm, or the hospital's doing your books or whatever, that they know about the grant, they're tracking that accordingly. Make sure your accountant knows, and make sure they're in your RHC policy manual. So, you know, these become part of your policies and procedures. So again, and this came across in the email, but if you're awarded less than $150,000, you'll have to reply by email just saying that you have adequate policies and procedures of these 5 areas that we went over today. If you receive more than $150,000, you have to provide your policies and procedures, okay, and also show that they are adequate. Again, this will all be by email, and it is an email conversation. So they may tell you to make edits, and again, you may compare with your friend across town that also has an RHC, and their reviewer told them one thing and your reviewer told them another. As RHCs, we should be experts at that, in that the regulations are up for a little bit of interpretation, and sometimes one reviewer says one thing and one says another. So you work with your individual reviewer and make sure that you have what you need to pass your financial management review. They are not saying some of you will be selected. They are saying that you will have to reply and you will have to do this. This is a requirement that HRSA has for giving out their grants. So this is not them wanting to do it. This is because they are required to do it through the federal government regulations. And then just a reminder that, let's say you got this grant and you have 5 RHCs, and then you also got that other federal grant, that Small Rural Healthcare Provider Quality Improvement Program grant, or you got the USDA Emergency Healthcare Grant, or you got a SAMHSA grant, or whatever else you got. If you received, if you get over $750,000, you are subject to an A133 audit, and you must go through that. So that's a big deal if you're part of a system, or you have a lot of RHCs or anything like that. You will You won't have a limited FMR, you will have the full audit, and those audits have the full report has to be shared with HRSA. So again, just to go over what will happen, you will get an email from the financial integrity staff with your grant number and instructions that you self-certify that you're compliant, you have these policies and procedures in place. You only have to submit them to the DFI staff, and they are not going to ask for financial information or account numbers. I've had a lot of you say, am I going to have to give my bank account information? No. Am I going to have to tell them how much money I make? No. This is certifying you have proper policies to manage a federal grant. In the past, you always had to have these policies in place before you could ever even get a federal grant. But based on the pandemic and the speed that they wanted to get the money out the door, now they're doing it on the back end. No, and I've said this before, but again, they will have a HRSA.gov email address. Then the team will review your information and let you know if your policies and procedures meet HRSA requirements or if you need to revise them. And if you make revisions, they're going to give you feedback. You worked with them to get them done. If they have to be passed by if you have a board or if you have a hospital that they have to go through or certain committees, that will have to be done also. I will tell you, I've done this with many of my clients, and most recently, I worked back and forth about 3 or 4 times to make sure that all their policies were compliant. And I will tell you, the DFI team was wonderful. They were very nice. They picked up their phone when I called with questions. They responded to emails within less than 24 hours. So they are contractors. They want to get these things done and crossed off their list. So they are extremely responsive. So again, use them as a resource, have them review your policies and respond accordingly, self-certifying what is required. Again, you can contact me at any time, and I am ready to take any questions that you have, if there are any, Danny.
Okay, we've got a couple that came through. The first one says, early on, I withdrew a large amount, about $14,000, to pay for billboards that I contracted for the entire year, not knowing that the 24-hour utilization requirement. I did pay the company the money, but it is for future months billing. Is that okay, or am I in trouble? Do I need bail money?
No, I think you're fine. As long as you have that invoice from the company showing that you did pay it, you can prepay things. That's fine, as long as that has been prepaid appropriately. So as long as you withdrew the $14,000, you spent the money appropriately on what you were supposed to spend it on, that should not be a problem. But again, this is why HRSA is working on the back end, because now they're trying to make sure you do have those policies in place, because there's a lot of people in your shoes that drew it down. As long as you use the money appropriately, you're fine. Make sure you get these policies in place so you do know that in the future for drawdowns that you make sure that's already been spent, or that you are going to be paying that within a 24-hour period.
Elizabeth, this is Mark. I never disagree with you, but I know David Cantrell, and it says here, do I need bail money? He will definitely need bail money at some time in the future. So.
Well, that I can't speak to what people personally need, but you also cannot, you cannot use this grant for bail money, so that does not count, but you'll have to find some funds on your own there.
Okay, here's another question kind of going along with billboards. We contracted for billboards with VAC's recommendation language before we knew about P&P procurement. How do we comply with going through a bid process?
I mean, honestly, and this is not legal advice. I'm just trying to tell you, if I were in your position, what I would do is I would now adopt the appropriate policies and follow them from here on out. If you already went through the procurement process, and I mean, you already decided to contract with someone, that's okay. You may want to write up the reasons that you selected them. So I'll give you an example. A lot of times in small areas, there aren't a lot of people to contract. Maybe that location of the billboard is the one that is the best one in your opinion. So, you might want to write up a justification to put with your grant file just to show this is why I use them. But I mean, I don't think you have to I would not personally end the contract and pay a bunch to end it and rebid it and all that. But, you know, if you can, if you're, you know, maybe you did that and it's for 3 months and you have a chance to change, then now that we know better, we do better, right? That's what Oprah and Maya Angelou say all the time. So when you know better, you do better. So then if you have a chance to recontract for that, you know, do it appropriately. But there are reasons too for sole source bidding, especially in rural areas where there aren't other options, and you can write that up.
Mark, were you fixing to say something? I saw your mouth open.
The thing I was going to say, it's sort of like on program evaluations, and a lot of people get behind on those, and they'll get, you're supposed to do one every 2 years now, and they'll get 3 or 4 years behind, and they'll ask me, well, should I go back and recreate one from 2 years ago? And I say, no. Get it caught up now. Don't go back and try to backdate stuff and all that. That's just going to get you in trouble. But get it caught up, and then when the surveyor comes, you'll be fine because you've got it caught up. So same principle applies, I would think. Yeah,
that's how I feel. I mean, again, start now and do it, spend it appropriately, do it. And again, it's not that you misspent funds. Now, if you did something wrong, misspent funds, that's when you hurry up and call your financial, grants management specialist contact, call them and get help. But I mean, as long as you're spending it appropriately, that's not going to be a problem.
Okay. A couple of admin looking email or questions. When should we expect the email from HRSA.gov?
So you should have received the first one already. And keep in mind, they're going to email the person who is the predominant contact on your notice of award. So if that person has already changed positions or they've left, I know I've had to deal with this with a couple of you, go into the HRSA electronic handbook and you need to update that. There actually is a HRSA electronic handbook YouTube page, and one of the options is change program director or project director. Go in and change that person because the other person is going to get the email. The other option is make sure you have access to that person's email. If they're no longer there or they're in a new position, make sure they're watching their emails if they still get those and forward to you. Also, when should you expect it? They are saying they are starting very soon. Now, I don't know what HRSA's definition of very soon and my definition of very soon are two different things. To my knowledge, best I can say right now on February 24th, I have not heard from anyone who has actually received an email that says submit these policies. I've talked to people who received the email that says, hey, we're going to be doing these reviews. So I have not heard of anybody. I'm sure it will come up on the Facebook page, Mark's Facebook page, if anybody does get that official email, so you guys start watching for it, and it will be staggered. It won't, because each of you will get contacted by your individual DFI reviewer. So I don't think anybody's got them yet, but I would expect them anytime. So watch them. And I always joke that HRSA and government emails always come out on like Friday nights or Saturdays, like weekends, whenever you least expect it. Midnight, weird things. Check your spam folders. I know you're like, Elizabeth, how many times do you say, I don't know how? It's like IT people who their joke is, before you call me, turn the computer off and turn it back on. Well, this is my joke. I'm telling you, before you say HRSA hasn't got with me or you don't have a notice of award, make sure you know whose name and email was put on it, and make sure they're checking their email and their spam and all their folders, because oftentimes it is caught in there. And again, if that person is no longer with your company, make sure someone's watching their email, or go immediately log into your HRSA electronic handbook where you have access to your grant and get that person changed. In order to change that person, so if I'm trying to change it to Danny has to be set up as well. So I have to be set up and Danny has to be set up. So if you're going to be the new person, go register yourself, connect yourself to the rural health clinic, and then you'll need to change project director. And if you don't know who that is, chase down your notice of award. Someone in your organization should have it, and it should have their name on it. And it will be whoever is the authorizing official. So sometimes there's 2 or 3 project names on it. I'm looking at an NOA right now to make sure I'm saying the appropriate thing. Ideally, everyone will get notified, but definitely the authorizing official will. And sometimes if that's, say it's a big provider-based RHC set, it may be the hospital CEO. And, they might miss it because they get, 900 emails a day. So make sure that you are watching that as well.
And Louise just commented and said her initial email says that starting February 22nd, they will be sending out emails. So just to say it will be
good information. Thank you. But again, I haven't heard from anybody. Mark, has anybody called you saying they got the official review yet?
I have not.
So,
okay.
but again, watch. And as soon as probably we get off here, I'll probably have a couple emails after this saying, Elizabeth, I've already got it. So, but watch for that. But again, be ready, start working on these policies right away because again, they ask for tight turnaround times and the feds have to get this done pretty quickly. It's already the end of February and your grant ends in June. So this is a tight turnaround for them.
Okay. One person did comment in and say they just got their NOA like 2 weeks ago. And she says, are there things I need to do to make up requirements that were already past due?
So whatever it says on your NOA, you are responsible for. So even it's just like if you miss school for 2 weeks, you're still responsible for the homework, even though you weren't there. So if things were due December 31st, but it's already February, you still have to make all that up for December 31st. And honestly, they probably won't let you draw down funds until all that is caught up. So make sure you get started on that right away.
Okay. And then I spent 14 hours on a grant application one time early on in our ownership of the clinic. We didn't get it, nor would they share with me why we didn't receive it. Do you have any advice or guidance on increasing my odds if I ever apply for another grant?
So this is hard. I've been asked this a lot. What are the chances of you getting a grant? This is difficult because in some ways, I joke whenever I do in-person grant presentations, I bring scratch off lottery tickets and I say applying for grants is about as likely as scratching off your lottery ticket. In other words, you can put everything in and not be funded, or you can do a bad job and get funded. All I can say is if you don't apply, you're not going to get grant money, right? It's like scholarships. If you don't apply, you're not going to get it. I've had a lot of clients that have had a lot of success. I mean, my clients have received over $80 million in the past 6 or 7 years that have worked with me. So, I mean, there is a lot of money out there. And I was a one-person shop for out of the 7 years, the first 5 years. So, I mean, just to give you an idea, like there is a lot of money out there that you can attain. That being said, there are people who spend hours on grants that you're not going to get. What I like to tell people though is that 14 hours was not wasted. Rehab that grant. Go to your state and ask them for funding. Go to a local foundation. I just was talking to actually one of my FQHC mentors, and she was saying she just got her health center got turned down for a large grant that they had worked really hard on and spent hours upon hours on. But she's going to rehab it and apply for a state grant that's due March 31st, and I bet she'll get that. So, it's not in waste. Keep those programs. Also, this is extra advice for what it is. Each of your managed care entities, your managed care organizations, for those in any of the Medicaid expansion states or your managed care states, those entities usually have money and do have grants if you ask them. So, that's really good. If you say, hey, I worked really hard on this grant application, we really need this diabetes program, go bug the Centene Corporation because they have a lot of money, and Centene's named something different every state, and I can't go through what they're named in every state. Mark might be able to rattle it off. I can't. But go to that Centene Corporation, that Centene Foundation, and say, hey, would you help fund this diabetes program? So I don't think it's ever in waste. Always rehab it, reuse it, and get the program off the ground. But I mean, grants are competitive, but again, you have no chance of getting it if you don't apply. I mean, I live in Indiana. We're 48th out of 50 for public health funding and like 50th out of 50 in public health outcomes, because people just don't apply for funding. That's why we're 48th out of 50. And in North Dakota, buddy, they apply for that rural health funding and they get it. So, I always encourage people to do it. But yes, it is a competitive process. You should know, but I know a lot of people don't tell you why you don't get funded. Sorry, go ahead.
Yeah, I was just going to say, you have a grant writing course, don't you, that lasts over like 5 or 6 weeks, to where people can sign up for that. Because what I what I used to, I remember when I worked for the hospital probably 40 years ago, we would apply for grants too. And what it seemed to me, it was more of an art than a science of putting the information together and sort of saying what meets the requirements of that, and then having a good plan to meet those requirements. But that was more, like I said, more of an art than a science. So, and I'm sure you'll teach that to them.
Definitely. Yep. We'll be getting information out about the course here again soon. We had great takers. There's a daycare that's been renovated from my last course. We had somebody who got a job promotion from taking the last course. So yeah, I mean, take advantage of those opportunities. I had someone get $200,000 from Purdue Pharma with my first course right before they went, the week before they filed bankruptcy to fight the opioid epidemic. So there is a lot of money out there, and I don't want you to ever think that you're wasting time or money. And I know this has got a lot of you excited about grants, and I really hope RHCs take advantage of those opportunities.
Thank you. Just got a couple more that came in. This one says we spent $14,000 on a digital sign that sits over our office entrance. It's a beautiful sign. And I heard somewhere in one of the webinars that a purchase of something like that might be an issue. Is it? And is there something special I need to do in order to justify that procurement?
No, I mean, as long as so probably, I mean, depending on your procurement policies, a lot of them are at 10,000. You do have to get bids. Some set it at higher. I mean, if I were you, I might set mine at 15,000. I'm just saying, I don't know. Check the law for sure. I know my example is that, and the one that HRSA shares is at 10. So make sure that check the law. But I mean, if you've done it, you have your proper invoice. And I think there's only just a few companies that make those signs. So, you know, state that you could get that now. That's actually a big issue with USDA buy-in mobile clinics. One of the big things you can consider is who can get it to you the fastest, because some of them are 2 and 3 years out with these RVs and everybody wanting RVs. So, you know, justify it that this is where I could order it. I got it here in, you know, speedy time, and this is why I use that. But again, at this point, adopt the policy now. Follow it from February 25th on out, or whatever, you know, whenever you get it done, March 1st or whenever you implement it.
Speaking of policies, does the effective date on your policies need to date back to before the grant award, or is it okay to have the effective date now?
I would put the effective date now. If they were in place, of course, put the appropriate effective date, but no, I mean, you can't, no, you didn't know they were going to put all these requirements on. And so I wouldn't, I don't ever think it's a good policy to backdate your policies. You know, put them in there now, follow them from here on out now, and do what you're supposed to do. Now, if you pass them and then you decide, oh, I want that $14,000 digital sign, and I'm just going to go over to my friend's company and not get any more bids, even though I just adopted that policy, yes, that's some problems, right? That I'm going to go buy it from my best friend's shop and pay extra for it. Yeah, we can't do those things. Make sure it's done appropriately. But what you've done is done, and from here on out, do the right thing.
Okay. A couple more just came in, so I'm trying to find myself. This one says, do we have to get bids for billboards? We are limited in our rural areas, and if we are just jumping on one when one is available, is there a dollar limit for getting bids?
So typically it is the $10,000. So as long as you spend less than that, it should not be a problem. But again, there are exceptions to that, like where you can say, I can't get other bids, or you write up an explanation. I've done that before that says, you know, this, in fact, I've done it for billboards specifically. You know, this is the best location of billboard. This has shown it brings in the most patients because of here's why. And, you know, just say there's a limited number. You know, show maybe that you reached out and contacted this other company. They don't have any available. You do that. But again, at under 10,000, it should not be a problem anyway.
Okay. And this particular one, her grant was for salaries only. Am I understanding that I have to document and payroll what I paid out of these funds? If so, there is no way I can go back to when the grant was first awarded to do this. We didn't get the NOA. This was the one that didn't get her NOA until like 2 weeks ago.
Okay. So then what I would do is, you know, who you put in as to the person that was going to get paid. So if you're paying Danny, then you can go back and say, you know, we paid Danny these dates. I understand that's not going to be in your payroll system, but write something up. I've done that before, write on an Excel sheet, have Danny sign that she knows she was paid by grant and worked these hours as shown in the payroll system or something like that. But again, the person still did the work, so that's not a problem. You still have it tracked that you paid the person this amount and you're getting refunded after you've already put the money out. So all that's good.
Yeah, Elizabeth, I've got a question, sort of in the lines of, I know I forwarded you an email yesterday, but we've got a lot of rural health clinics that now that they've gotten some grant money and they've been thinking about becoming a not-for-profit. And this is probably an entire webinar just on this one issue here, but and you talk about being the expert in converting from an RHC into FQHC. So can you just give us a little bit of the very short version of that, and maybe we think about later on doing a webinar on converting an RHC to an FQHC, if that's running in the back of their minds, what that's all about.
Yeah, so I mean, I've done it, and I've done it as a consultant, and I've done it as a clinic manager. It's definitely doable. From CMS's standpoint, it's literally a click of a button, so they like that. From a HRSA standpoint, it is a lot of paperwork. I'm not going to lie, but to become an FQHC or to get a lot of grants, you do have to be a nonprofit organization or a public entity, which a lot of hospital districts are in certain states, or universities or towns or county health departments. So any of those do qualify. The bad is it's a lot more paperwork and you have a nonprofit board. The good is that you can get a lot of grant funding and also the 340B drug pricing program, which most of my FQHC, in fact, probably all, I think, of my FQHC clients get way more from the 340B drug pricing program than they get from grant funding. That being said, if you are a provider-based RHC, you are oftentimes, not always, eligible for 340B, and you may be getting that. And that may be another webinar I want to do, is maximizing 340B too, because a lot of people aren't maximizing the revenue that you can bring to your clinics and hospital for that.
Okay.
All right.
Amy, do you have any more questions?
I think I've covered them. You might want to, you can scroll through if you want to, Mark, but I think I got them all.
I scrolled through them earlier, and I don't remember any more either.
Okay.
So, well, Elizabeth, thank you. You always do a great job on getting everybody up to date on all things grants and FQHC. So we appreciate you very much.
Thanks, Mark, and thanks for organizing, and good luck getting all your policies in place. Start today. Good luck.
Okay. Thank you. Thanks, everybody. We'll talk to you guys. See you tomorrow. Most of you will see tomorrow when we do the billing thing. So thank you. Be safe. Bye-bye.